So today we're confirming 679 new cases of COVID-19. We are always going back and improving the data, so after removal of duplicates, our total state case count is now 38,298. Today we have 656 Kentuckians in the hospital for COVID-19, 147 in the ICU, 97 we need to be praying for that are on a ventilator, including one of my friends in northern Kentucky. We have a 5.68% positivity rate. I'm glad that is below 6, which we only reached for a couple of days, but we have got to get that lower. Certainly the White House even said for regular reopening, we need to get that number under 5%, and those are their doctors giving their opinion, not just ours. Today's numbers include 77 kids under 18. When we talk about what we are seeing, an explosion of younger people, school-age kids, 77 under 18 is pretty significant in 679 total cases. They include 3 school-age children in Barron County, one that would have been in middle school, 2 that'd be in high school by age, that presumably would have started in the schools if they go ahead with their current plans instead of doing distance learning until we can get this thing under control and open up at a time when I believe that we can do it successfully in September. Today's report also includes another 3 school-age children in Hardin County. So with the 6 yesterday, that's 9 in the last 2 days. Again, it would be positive, and at this point could potentially be spreading inside of a school. Today's new cases by county: Jefferson 193, Fayette 44, Lewis 30. Shows how quickly this can jump up and grow in a state. Warren County 30. They've continued to be in double digits just about every day for the last several months. Hardin County 26, Madison 21, Barron County 18. Barron County, especially for the population, has had significant cases over the last several weeks. Kenton County 18, Boone County 17, Harlan 14, Clark 12, Bullitt 10, Laurel 10, Pulaski 10. So again, we are seeing significant increases in our school-age children, and I hope that makes everybody pause. Commit to not experimenting with our kids. Make sure we are learning best practices from other people making mistakes so that we don't make them with them. In my core, I want to get our kids back in class. I want to get my kids back in class. My job is to tell people when I don't believe it's safe, even if it's unpopular and even if it makes people call you names. It is my job to make sure I do the very best I can for Kentuckians. And I hope that schools that are going to make different decisions, whether private or public, are going to be honest about clusters or cases that they have once they start, but also ones they've had over the past several weeks or several months. I think it's critically important that parents with kids coming back know the experience that schools have been having. Today we're also reporting 8 new deaths: an 83-year-old woman in Jefferson, an 85-year-old woman in Bell. They're all women today. An 82-year-old woman in Franklin, a 92-year-old woman in Franklin, an 85-year-old woman in Casey, a 75-year-old woman in Hopkins, a 77-year-old woman in Lewis, and a 63-year-old woman from Christian County. Those are most likely moms, grandmoms, sisters that people have lost, aunts, loved ones. So let's make sure that for them we are strong. We light those green lights. We ring the bells every day at 10 a.m.